If you had a hysterectomy and you're struggling with any pelvic floor issues, you're not alone. A lot of women will experience some discomfort, even symptoms of prolapse or bladder issues after having a hysterectomy. But have no fear. I am here today to guide you in the right direction and give you some tips and help you learn more about your body, so therefore you can be able to heal yourself and get better. My name is Dr. Dawn Andalone. I'm a pelvic floor specialist, and helping women after a hysterectomy can come with a lot of questions you might not get answered by your doctor. But seeing a pelvic floor physical therapist is going to guide you in the right direction and help put you at ease, especially when it comes to getting back into activity and helping some of the issues around your pelvic floor and around your core muscles to make you feel more confident in your own skin again. Now, what happens after a hysterectomy? What happens to your pelvic floor, these muscles in red, this is the bottom part of your pelvis, and no matter what type of hysterectomy you had, a total hysterectomy, a partial hysterectomy, your pelvic floor muscles may weaken a little bit. You may lose a little bit of support around your bladder. And so therefore, learning how to be able to restore this area and help those muscles regain their function again is going to provide more support around your bladder and around your pelvic area. So therefore, it can cut down on having any unwanted side effects. Common post-surgery symptoms may include some lower back pain, some bladder incontinence, some constipation. You may experience some of these symptoms, but you are not alone. So recovery, being essential on learning the right types of exercises, can really restore that function, bowel and bladder function, help you return to being intimate again with your partner and feeling confident and comfortable about it, and also getting back into fitness activities, and therefore you can start to feel like yourself again after this healing phase has gone by, or maybe the pain level is going down. Learning the strategies to help you recover is going to help you in the long run. So here are some safe and effective recovery tips. Working on some breathing exercises. You can reference back to some of my other videos. One on safe core exercises after a hysterectomy is a great one to watch, where you're going to learn about some breathing exercises like diaphragmatic breathing that helps you connect to your core muscles again and helps restore function there too. You can do some gentle pelvic floor contractions and relaxation, and learning that by just using your breath, because when you're breathing, your diaphragm helps also counteract what the pelvic floor muscles do. And so when you're working on some breathing exercises, you'll also gently learn how to engage your abdominals and your pelvic floor. So therefore, they can do what they need to do when you're becoming more active and moving around. Those muscles need to learn how to work again. So I'll talk you through just some gentle movements that you can do. These gentle movements are good for your core and your pelvic floor. The first one being a gentle pelvic tilt exercise. So from here, making sure that you relax your neck and shoulders, relax your hips, and you're just gonna take your lower back, just gently pressing into the mat, into the floor. And with a pelvic tilt, my pubic bone lifts up just slightly, and then I engage those lower belly muscles just a tiny bit. And then I release them and I let them go on my inhale. And then as I exhale, I'm pulling in and up from the pubic bone to my lower belly there. Now, this gentle exercise can be done once you've been cleared by your doctor, just to start a little bit of movement. It starts to feel like you want to engage these muscles, but doing it in a safe manner by doing some gentle pelvic tilts. Then you can turn that into a bridge exercise. So you're gonna tuck the pelvis a little bit, pressing the lower back down, and then lift your hips up so you're doing a small bridge. And as you do that, you're gonna engage just pulling in a little bit through the pelvic floor muscles, just enough that you're comfortable, and then lifting your
bottom off the floor. And you can repeat that about 10 times, but that will start getting some strength through your core and also the bottom part of your core, which is your pelvic floor area. We don't want to overdo Kegel exercises and really a lot of strengthening there. You want to engage this whole area and use it all together with your breathing.
Even some gentle hip exercises to do can be very helpful. I have a full program on the best type of hip exercises, back exercises, and core and pelvic floor restorative strengthening exercises to do. I'll put in the description below with my hysterectomy recovery program. So a hip stretch that can be helpful to do is stretching out your hamstrings. And I'm gonna go on my back, take my hand behind my thigh, and I'm just gonna gently lift and lower and bend and straighten that knee, and even pull that knee in toward my chest. You may get a little stretching through your hips and through your hamstring here. You can go back and forth about 10 times on each side. It will feel good to loosen up those areas if you have been resting a lot and being able to start moving and walking more. You want to get a little more stretching through your hips and your hamstrings. The other safe recovery tip I want to teach you is just about listening to your body and not overdoing it. You don't want to lift anything heavy. You want to really be mindful of housework to do in the first 6 to 8 weeks where you're getting some help and you're not doing a lot of lifting laundry, you're not lifting kids everywhere, and you're not standing for long periods of time. Even vacuuming or climbing stairs can be a little more strenuous, and you want to do anything that's not going to put a lot of pressure downward on your pelvic floor area or through your midsection, especially if you have an incision there that needs to heal. So making sure that you're not lifting too heavy, you want to listen to your body. So I usually recommend the same amount of time that you're down resting. You can balance that out with starting to be up a little bit more and gradually start your walking again on flat surfaces, not going on big hills, but just start some light walking around the house and then outside. Also, hydration is going to be very important to be able to flush those fluids out, prevent constipation, and also help up your fiber intake, so therefore constipation doesn't remain an issue. Being hydrated does help your body heal. It allows for all of the inflammatory process to take its course and kind of flush out the body. And so therefore, if it's good for your digestive system, it's good for your lymphatic system, and it's great doing things like electrolytes or water. You want to not have a lot of caffeine, but things that are going to be more hydrating. So what to avoid and when to seek help? Well, what to avoid, you don't want to do a lot of, like I mentioned, lifting or a lot of heavy housework, or going back to activity and doing things like crunches and planks too early. This can put a lot of strain on your midsection and on your pelvic floor. So learning how to gradually increase your activity and working on more restorative type exercises are going to be helpful before you get back into those types of movements. And then also, you don't want to be straining during bowel movements. So if you are having issues with constipation, find a way, or even talk to your doctor about a supplement, something you can take to help ease those bowel movements. Getting something like a squatty potty, I'll put a link to that below as well, but that will create an easier bowel movement so you don't strain when you go to the bathroom. Any signs that you may need to reach out to your doctor again, obviously any heavy bleeding, anything that looks red, swollen, or painful around your incision sites, anything that is not normal based on what they have told you about how your recovery should be going. If you have red flags of any sort, please reach back out to your doctor. But if you're getting a lot of pressure, heaviness in the vaginal area, if you're having increased pain, or you have a fever or some sign of infection, then definitely you want to seek professional help and make sure that you watch out for those signs and symptoms. So overall, you have the tools to help guide you in the right direction. I have lots of videos on hysterectomy recovery on this channel, and I want you to seek out expert help for guidance through this time. Reach out and find a pelvic floor physical therapist, or try reaching out via my website below. There are natural solutions of what you can do to help your body heal the best way after a hysterectomy. You should not be scared about it, but you should find resources to be able to guide you and support you on your healing journey. Listen to your body, take care of yourself, and I wish you the best with your surgery.